When you begin to even suspect that you might be dealing with fertility problems, a lot of questions start running through your mind. It can be very overwhelming. So we're here with answers to 8 common questions people have when they're experiencing infertility. It's different for everyone. On average, most couples will become pregnant within 1 year of having regular intercourse without contraception. However, every individual and every couple is different. Factors like age, health, and frequency of intercourse can make it more or less likely that you will conceive. Generally speaking, the older a woman is, the less likely she is to become pregnant on any given month. If you're under 35 and have been trying for 1 year without success, or over 35 and have been trying for 6 months, it's time to talk to your doctor. Remember, getting pregnant takes time even when there are no problems. Don't get too overwhelmed just because you don't conceive in your first few months. Absolutely. Infertility affects men and women equally. Testing the fertility status of both partners upfront will help your physician decide on the best treatment options. The doctor will want detailed information on when you started trying to get pregnant, how often you've had intercourse, any medical conditions you or your partner may have, and any medications you or your partner take. You might be asked a lot of personal questions about how stressed you are, whether you use drugs or alcohol, what your diet is like, and whether you have any sexual problems besides being unable to get pregnant. These questions are necessary for the doctor to determine the best types of tests to order. This depends on the evaluation and treatments used, but can be very expensive. There's a huge range of costs associated with treating infertility. A less invasive procedure like IUI may only cost you a few $100s, while a more advanced treatment such as in vitro fertilization can cost tens of thousands of dollars. Sometimes, depending on the particular treatment and the insurance company. Currently, coverage for infertility treatment is only required by law in 15 states. The National Infertility Association, Resolve, has a great resource on infertility insurance coverage that's available at resolve.org. Talk to your family doctor or your OB/GYN. Tell them you've had difficulty becoming pregnant. They will be able to talk things through with you, and then if necessary, they may point you to a specialist. It might be uncomfortable for some of you to discuss private sexual matters. However, your doctor discusses these issues frequently, and being open will provide them with information they need to improve your chances of getting pregnant. Remember, these are common questions because infertility is a common problem, but there are many resources that can help you along your way.